Hi, my name is Dr. Ken Williams, and I'll be presenting you a lecture on in vivo FUE graft splitting. Originally described by Dr. Robert True as fractional harvesting, in vivo splitting is a particular technique that I think is extremely invaluable if you are doing FUE donor harvesting. Again, we give credit to our good colleague and FUE pioneer, Robert True, for originally describing this in the literature in Hair Transplant Forum. When we look at the safe donor area, we have simple donor areas, moderate, and complex donor areas. Here is an example of a relatively simple donor area. There's not much you can do as far as in vivo splitting or fractional harvesting here. These grafts should not be disturbed, and if you do have this patient with this type of pattern, you would harvest these fully. Now, when you start looking at other areas and other patients, for instance, this is an example of a complex donor area, there are many opportunities here to split these grafts without doing harm. Looking at this red box here, we see what looks to be a 3 or 4 hair graft along with a single graft on the left. With this particular donor area, we have a lot of opportunities to leave behind melanin-containing hair shafts, and that helps to decrease the appearance of donor depletion. So let's take, for instance, this big green box here. As you can see, this is a very complex family grouping here. And we could very easily remove this particular graft here. That looks to be a 3 hair graft. That's a 2, that's a double. Here's looks like 2 double. So this is a particularly wonderful opportunity to get grafts, harvest them, and leave behind melanin-containing pigment. Therefore, that reduces the appearance of donor depletion. Same with here, you see a 2 hair and a 1 hair. You can successfully remove and harvest, and you can use a 0.9 or 0.95 millimeter punch. It does not really matter. There would be very little damage done here, and leaving behind that single, it would certainly, if you do lose it or you damage it, it could and most likely will regenerate itself. FUE pioneer Jose Lorenzo is a big proponent of FUE graft splitting, and he is not concerned at all because he feels very strongly by his over 20 years experience that these grafts will eventually regenerate even if they're a little bit damaged. Looking at this red box here, again, lots of opportunities to individually select out a 2 hair graft here. That may be a 3. So you can remove one of these grafts and leave behind melanin-containing pigment. And the same here with this purple box. So, you know, these are great patients, and sometimes, again, as you look at these patients and you actually start surgery, you begin to see these marvelous complex follicular family pairings and groupings. A lot of terms to describe that, but you know, look at this picture here. There's so much opportunity that you can harvest from this patient, and you can cherry pick the 2 and 3 hair grafts if you want, but look how much you're going to be leaving behind. Again, the most important aspect to this is the donor architecture is preserved by the partial fractional harvesting, and that's very important for success. So let me demonstrate a movie that I created, and you can see some actual harvesting. So here I am with my wall unit. It's a 0.9 cross-sectional diameter punch. I'm carefully selecting out these multifamily groups. Here's a group here, it's a 3 hair graft. I'm leaving behind 2 other follicular units there. Same thing with this unit here. I'm going in, scoring and dissecting down to the depth and releasing the follicle from the surrounding tissues. This is a little bit in slow motion, so it does help a little bit here. And the same thing, I'm going out, taking part of this multi-family complex and just dissecting out a 2 or 3 hair graft. So this is pretty central to the concept of in vivo slitting, and I'll let you watch, and thank you very much.